Hello, my name is Marta Roxberg and I'm Senior Partnership Manager here with FET. I'd like to start by saying welcome to this webinar with the title The Health Partnership Scheme, Sustainability Scale-Up and Access Large and Small Grants Application webinar. You are currently on mute, but you should be able to hear me and see the presentation slides. This webinar will take about 60 minutes and there will be time for you to ask questions either by unmuting yourself or by typing in your question in the chat box towards the end when there's question and answers. So apart from myself, today's panel includes Sophie Pinder, who's our Monitoring, Evaluation and Learning Officer, Salman Shear, Grants and Finance Officer, and Paris Tuo, who is our Grants Officer. And over the next 60 minutes, we will provide a brief introduction to the Health Partnership Scheme and this particular call. And after that, Sophie will provide a guide to the grant application form. Salman will provide an overview of the budget template, and Paris will finish by giving you more details on the application process itself. And then we will have roughly 30 minutes for question and answers at the end. So let's start by giving a brief introduction to the Health Partnership Scheme. This is a program that's funded by DFID, and FET is managing the program on DFID's behalf. The program supports health partnerships between UK health institutions and health institutions in low or middle income countries, mainly in Asia and Africa. And the program has been running since 2011. We've had about 249 projects so far, contributing to the overall program aims, which are to improve human resources for health and health services in low and middle income countries, for UK health institutions and professional volunteering their time to build the capacity of their counterparts in Africa and Asia. The program aim is also to bring benefits back to the UK through volunteer NHS staff returning with increased knowledge, improved leadership skills, and a greater understanding of how to innovatively deliver healthcare with limited resources. And this map is new and it will soon appear in an impact report on the Health Partnership Scheme, but I'm hoping that you will see it okay on your screen. It's just to give you a sense of the scale of the program. So it's been 249 projects in over 30 countries, and it's been projects with quite a wide range of health themes covered, 12 so far, and over the last 7 years, 84,000 health workers have been trained through the program. And if you want more details about the program itself, because due to time limits we can't really give much more information, then please do visit our website. In 2016, last year, DFID commissioned Triple Line and Health Partners International to conduct an evaluation of the Health Partnership Scheme. It was quite a big evaluation. It was conducted over 8 months, and that has influenced key recommendations that I wanted to touch on briefly. So basically the main recommendation from the evaluation was that the Health Partnership Scheme should think about ways of being more strategic, of looking at how a health partnership project can contribute to the wider health facility or community in a country. other recommendations including improving learning, synergies and in-country coordination between health partnerships and other actors in the health sector. The recommendation from the HPS evaluator was also to find ways to improve the evidence base for outcome impact from the projects, as well as the value for money of the health partnerships projects. And another main recommendation from the evaluation was to think about ways that gender equality and social inclusion could be included into project design, implementation, and monitoring, evaluation, and learning of projects. The program was recently extended up until February 2019. It's quite a modest extension with a grants budget of 1.5 million. And this will be available for small and large grants over a 12-month period. And because the evaluation was conducted quite recently, the focus for the extension is really on responding to the recommendations of the evaluation. And so the focus is on sustainability, scale-up, and access, using previous projects of what has worked, and it's open to both previous health partnership projects under the HPS as well as other health partnership projects that have proved successful in the past. And the focus countries are Tanzania, Uganda, Zambia, Ghana, and Myanmar, or Burma as it's sometimes referred to. And I will end there with a very brief introduction, but there will be time to ask questions later on. And now I'm handing over to Sophie, who will guide you through the grant application process.
Hi everyone. So before we go any further, I'd like to spend a bit of time talking about the eligibility criteria. You may have noticed that I've included some handouts to this webinar that you should be able to access, which obviously includes all the application documents, the calls for small and large grants, the questions and answers document, which is very important, and also the application template and budget template. So up on the slide is the core eligibility criteria and country eligibility. Marta has already mentioned some of this, I won't go through all of it. So in terms of the first point, applications must be made by established health partnerships between UK health institutions and overseas health institutions. So the lead UK partner must be an eligible health institution, not an NGO. You will find more details on what we mean by health institutions in the Q&A document. NGOs and charities can be involved in the partnership if they wish, but you will need to demonstrate the added value of this in your application form. The lead UK partner will be the contract holder with FET and responsible for reporting back to FET and also kind of managing the finances and overseeing the project as a whole. So what we mean by established health partnerships is that this is not open to partnerships that are new and looking for funding to set up a health partnership. It's really open for health partners that have already, some track records and whether they've received previous health partnership scheme funding or have received funding from other sources. And this is in line with the purpose of this specific grant call. In terms of the fourth criteria, which is here, so it's slightly different for small grants and large grants. So apart from the amount of funding that you're applying for, the difference between small grants and large grants are the kind of the number of institutions that where you're looking to implement your project. So for small grants, they need to be implemented in obviously one or more low and middle income country health institutions, whereas for large grants it has to be more than one, so at least two. And you can find more information on this in the Q&A document under the question, what are the differences between large and small grant streams? Stating the obvious, but always good to refresh our minds, documents need to be submitted. So the application form, the budget template need to be submitted by midnight on the 1st of October. It might be worth, if you're not using Word or if you're using Mac software, to just check that the formatting hasn't been messed up before you submit your documents. Do not apply if you're not eligible. It's a very competitive grant stream. There's a very limited number of funding available. We are going to receive a number of high quality eligible applications. So if you're not eligible, you will be wasting your time, because we won't even be able to consider them for review. If you aren't sure, you can always email us and ask. That's fine. One partnership can apply for funding for more than one project, but they need to be submitted as separate applications and preferably in separate emails. Now, so up on the screen, I've got the project requirements that are included in the call documents. So you've got project requirements and partnership requirements on this second slide. So these form the requirements for the selection criteria. So if you're eligible, we will assess your proposal based on each of these points. I really strongly advise you to refer closely to the questions and answers document that I already mentioned a few times, because we do explain each of these points in more detail. And also maybe a good idea to kind of use each of these points as a checklist once you've drafted your application, to make sure that you've covered all of these points. We advise you to complete the application form before you complete the budget template, because you'll see that they're quite closely linked. So now I'm just going to remove the slides and open the application form that most of you will be familiar with. In terms of the summary details section, the first section, please avoid using any acronyms or technical terms to make your application as readable as possible for someone who isn't familiar with what you're doing. We advise you to complete the funding categories sections once you've completed your budget table. So the duration is, project duration has to be 12 months, and projects must be completed by the 30th of November 2018, so it doesn't really give you much flexibility on when it should start. For this second section, partnership, this is really a chance for you to tell us about your partnership, and please assume that we don't know, even if you've received previous funding from FAIR, that just assume that we don't know about your partnership. So you can explain in these two sections kind of what's the history of your partnership, when you were established. Also describe grants that your partnership has received in the past, whether it's through FET or through other donors, and also might be worth, well, it's actually quite it will help us to assess if you give us some evidence of how successful your projects were in the past, so you can give an idea, a sense of the impact that it's had. Moving on to section 3, justification. So for this section 3.1, just make sure that you're clear on what we mean by a health system, and you've got some really good examples of this in the Q&A document. In section 3.4, we're looking for information that that shows that the project that you are proposing suits the local context, and that you have considered other organisations that are working in the same area on the same issue. And basically what we want to make sure is that you're not kind of duplicating efforts, and that you're not kind of significantly overlapping with existing projects. So section 4, the project description. So those of you who are familiar with applying for HPS funding will see that we're no longer asking you to complete a full project plan with outputs, outcomes, indicators, targets at application stage. Here, where it's a little bit more flexible, we're asking you to describe the changes that you expect to see as a result of your project at different stages. So by the middle of your project, so 6-month mark, and also by the end of your project. You have some really good examples in the Q&A document once again. And for those of you who are familiar with monitoring evaluation, you'll know that the changes in the middle, by the middle of the project, are more kind of related to changes that come immediately after activities or an intervention, and then the changes by the end of the project are more related to kind of outcomes, kind of what comes next. And please do read the examples provided in the Q&A document. Please avoid or don't add any more changes than the 4 that there are here, because you'll see when you open the budget template that the way that your budget is linked to these changes. So just include the main 4 changes at these 2 stages of your project. Right, so I won't touch on these points. I'll go straight to the project management and support section. So for section 5.1, we're looking for information that will help us assess your partnership's capacity to deliver the project. So please note that if your project is shortlisted, we might ask you to provide documentation to support this, such as memorandums of understanding, letters of agreement, or ask you for questions if you're invited for an interview. Also advise you, in order to complete this section, to refer to our principles of partnership on our website. That explains a little bit how, what the good practices are in terms of partnership working. Now, this final section before the budget is around volunteering, so for questions 5.4 and 5.5. So make it clear whether you're sending short-term volunteers, long-term volunteers, or a mixture of both. Number of volunteers will be helpful. And also you've got a section around staff and volunteer safety. So we're looking here for basically evidence that you've got good practice in place in order to both recruit and manage volunteers, such as duty of care, volunteer recruitment, management policies. Again, we might ask you for more information and documentation to support this if your project is shortlisted or successful. And now I will hand you over. I'll put the slides back up, and I will hand you over to Sam.
Okay, hi everyone. So this budget template for this particular call has been updated from the previous budget templates that some of you might be familiar with, and this is following recommendations from the HPS evaluation, and we believe that the new format can help to better capture the value for money data that we are required and encouraged to do so. The main difference to the format are the new sections for the changes or the expected changes as a result of the activities you'll be undertaking. So the template contains sections for up to 4 changes, and this is what Sophie was referring to earlier. And then when you're completing the budget, please do specify the change where it's requested on the sheet, and ensure that this corresponds with the changes stated in your application form. There's also a section at the above the change sections, and that's for general project costs, and this is for any overheads that may not relate directly to any of the changes. And then at the bottom there is a summary section, and this section is locked. It contains formulas that will populate the cells as you complete the budget template. So largely, even though the format has changed, the budget, the categories remain largely the same as in previous formats. And so the budget categories still include project management, equipment and refurbishment, travel, and monitoring and evaluation. The main change in categories is project activity, and this should also correspond with the narrative application form. And so the the new category project activity replaces what was previously training and capacity building, and represents each activity being undertaken to achieve the change or changes you have set out in your application form. So when you're completing this section of the budget, please specify each activity in column A, and provide a description of the costs related to this activity in column K, which is the notes. And these activities should correspond with the activities stated in section 4.2 of your application form. So as Sophie, just to add here, you can add any additional lines if you need to on this section if you're doing more than 4 activities. Okay, so when completing up your application, we recommend that you complete the narrative part where you can set out your changes and activities before attempting to do the budget. And so once you've established your changes and the activities to achieve those changes, you can begin to consider the related costs. In the budget template, you can begin by entering your project details in the top right of the sheet, and this is what's shown on this slide at the moment. So what you have to enter here is the lead UK partner, the title of your project, and who is going to be completing this budget. Okay, and so the various sections, you can then begin to complete the various sections once you've added the introductory details. In the main budget, you will need to populate column C with costs per unit, and column E with the number of units, and provide any relevant details in column K. You only need to complete the budget for the number of changes proposed in your application and the activities related to these changes. As per the previous funding calls, project management and equipment and refurbishment costs should not exceed 20% of the overall budget. You can track overall percentages in the budget category summary section at the bottom of the template. So that's a very brief overview of how to complete your budget template. And if you have any questions, please go ahead and ask these once the presentation section is over. I'll now pass you on to Paris, who will run through the application process.
Thank you. Hello everybody. So yeah, I'm just going to go through the application process briefly, and yes, you can ask questions at the end if I've missed anything out. So yes, you will need to send your application form and budget to the application@thet.org mailbox, and if you do not get an email acknowledgement within 48 hours, please do resubmit your application again. So the applications will be reviewed by a selection panel including THET staff and external advisors, and each application will have 2 to 3 reviewers, and we will inform you of the outcome mid to end of October. So for the large grants that will be shortlisted, we will arrange project meetings with you, the UK lead and the overseas lead, so over Skype, whatever's more convenient, and this will include a due diligence assessment. So the award process, so just because you've been shortlisted as a large grant doesn't mean that you are guaranteed funding. We just want to kind of talk to you, find out a bit more about your project, and then we'll make our final decisions. And we will also be announcing the final decision for the large and small grants at the same time. And so if you're successful, we'll move to the contract stage end of October, November, and all projects will start no later than the 30th of November, and then we will start doing the inception meetings. Thank you.
Okay, so now we've got more than 30 minutes for questions, which is good. So there are 2 ways to ask questions. If you have a microphone, what you can do is, I can see, no, we don't have any questions. So what you can do is you can put your hand up virtually, which means that you press a yellow hand button icon, and once you've pressed that, we will invite you to speak, and we will unmute you at that stage. Alternatively, you can type a question in the question section that should be visible, and in that case we will read out your question and answer. So we have one question that I'm trying to get up on the screens. Okay, so we've got several questions that have been typed. So the first one is, we are a faith-based body under the Orthodox Church in Uganda charged with coordinating health service delivery. How do we establish partnerships with UK health institutions such as we can benefit from the HPS? Right, so it's a good question, but as we were saying earlier, this particular funding stream is only available to partnerships that are already up and running, already established. So what we could do is direct you to some information that we've got on our website on how to establish a partnership with a UK institution. But unfortunately, we won't be able to support any startups as part of this stream. And also, please do keep an eye on our website if we have any other grant funding opportunities available for new partnerships. Does anyone else want to take another question?
So the next one is, can international NGOs working in India apply?
So unfortunately, India is not a priority country for this particular call. So an application from an NGO working in India would not be eligible. But again, as Sophie mentioned, there may be other opportunities in the future where FET could support such work, but not under this particular call.
And also on our website, as Sophie said, we have an alternative funding list which has funding opportunities outside of THET, So please do go and have a look there, and we will be regularly updating that.
Okay. Shall we take? I think there's several people that have their hand up, including Paul. So Paul, I'm going to unmute you and you can ask your question. Hi, Paul.
Hi, thank you so much for the presentation. Sorry, I couldn't find the type in button, so let me just try to talk as clearly as I can. Paris, I don't know if you need to specify the file size of the applications, because sometimes the application gets really big and bounces back from the email. So I don't know if it's important if I missed it, but it would be okay to mention the file size of the application that are being sent to the email. My second concern regarding what Salman said is the issue of adding the number of lines for the activities. In terms of review, I would think having particular, maybe we limit it to 6 activities, would help us have a balanced argument. Probably someone would point out the 6 most important or the 4 most important. Otherwise, if it's left open and everyone can actually add as much as they want, then the activities could get really way too many and the review could weigh us down. Those are my 2 issues. Thank you.
Thanks, Paul. Just on your first question, Paul, for this call, we're only asking for 2 documents. One is your grant application form, and the second one is your budget template. And so we do not need any other attachment. If for some reason it's still difficult to send an email with both attachments, so both the grant application and the budget template, then our recommendation is that you send them in 2 emails, but clearly in the subject indicate that this is 1 out of 2 emails referring to the same grant application, so that they don't get lost in our inbox. On your second question, and my colleagues can add to this, I think what our main recommendation is to try and be realistic, because it's a 12-month implementation period, so there's only so much you can achieve within 12 months. And we recognize that, and so we will also ask applicants to be realistic in their ambitions for this call.
Okay, thank you. So we'll just read out a few more questions that have come up by message. So one of them from Nick Sankey say that he has. So we have 2 potential projects with the same partner hospitals in the UK and overseas, but they are discrete. Are we able to apply for both? One would be small and one large. Nick, not too sure what you mean by discrete. As I was saying earlier, you can apply for several grants for different projects, but they do have to be submitted as separate in separate application forms. Something to bear in mind is that although I do say that, just keep in mind that it is a very competitive process, and the likelihood that we will award several grants to the same partnership are quite low. So if you need more information, or if you're not sure whether you're eligible, please do feel free to email us at application@fet.org.
So the next question is, please could you talk a bit more about research and dissemination requirements? Thanks. That's from Julie Marshall. So if you want to.
Yeah, I can try. It's quite a broad question. I could go on about it forever, but I'll try to keep it brief. So in terms of research and dissemination, I guess you have, beyond the kind of the monitoring and evaluation requirements that you have for your project, that we ask you to describe. We ask you to describe how will you collect data, how will you analyze data in the application form. We do encourage you for this call to, if possible, collaborate with other organisations that you've collaborated with before, or new ones, in order to do a bit more in-depth analysis, a bit of research. And for instance, you'll see in this call that one of the requirements is we ask you to consider how your project will have an impact on specific groups such as women, girls, and people with disabilities. So if you haven't done that before, it might be worth collaborating with some researchers, whether it's consultants or a research organisation. Dissemination requirements. I'm not too sure what you mean by that, Julie, but what I would say is that because it's a partnership, if you look at our principles of partnership, we do kind of beyond the whole reporting requirements to FET and to DFID, we do encourage partners to foster learning and look at ways of how they're disseminating their learning and their impact within the partnership, and also with their beneficiaries and other stakeholders.
And another question is it a requirement that your partnership has received external funding previously? And that's from Jenny Riverdine. And what I would say to that is we do ask for a track record. So this call is for established health partnerships. And so the assumption is that you have received from some funding in the past to do activities together in your partnership, whether that's through FET under the HPS or under the J&J program or other funders is open. But we do ask you to show some evidence of what you have achieved in your partnerships in the past.
Okay, so the next question we have is, thanks for the information. In order to deliver this project we need some IT infrastructure to be built up. Does this count as equipment cost or not? I would say that can be included as part of your equipment and refurbishment costs. But again, you should try and provide justification for your cost allocation, and please keep in mind the overall percentage thresholds for equipment and refurbishment and project management, which are 20%. And you can keep track of those within the budget sheet. So as you fill in your different budget sections, it will pick up the formulas at the bottom should give you a continuous overall budget percentage for all the budget categories.
Okay, we have also a question from Hiroteka. Does this call rule out NGO applications completely, or do we just need to show the clear added value to take part in this call? Marta, do you want to answer that?
Well, I think the main thing to say is that it needs to be, you need to have a partner in the UK, which is a health institution, whether that's the university or a hospital, and then a partnership in country that's the university or hospital. We have had NGO partners in the past, but the main focus of FET's model is on the health partnership between two health institutions. So you need to show that you have that in your application, and then it's okay to have an NGO partner as well, but it's generally part of a broader partnership between health institutions and an NGO.
Okay, there's a question from Geraldine Lowry. Are all applications expected to include analysis of barriers for women and girls and disability, or would it be acceptable to prioritise one of those two groups in a small grant application? Yeah, I think that's fine. I would say that it should include analysis of barriers for women and girls and disability or disability, depending on the issue that you're trying to address. It depends also on the context that you're working on, so that's fine.
So the next question from Jenny Witherden. What is your definition of volunteer, and does this mean that staff costs for delivery will not be funded at a daily rate? I'll address the second part of your question. So staff costs, I would say, would come under project management, and you should be able to include some staff costs directly related to delivery under that part of the budget, either, I guess, under general project costs or any that are related specifically to the changes. I will ask Marta to define volunteer. Sorry, Marta.
That's a good question. I don't think they actually provide a definition at the moment, but basically a volunteer, as we see it, will be someone that volunteers their time on a pro bono basis to support a project. So not someone that's employed, but providing support outside of their work to support a specific project.
So the next question is also, would you accept applications with a duration of less than 12 months? That's from Geraldine.
Yes, if it's between 6 and 12 months, but ideally we would like applications that are for 12 months, because the emphasis on this call is on impact and scale up, and we believe that you need a longer time frame to achieve that.
Okay, we have a question from Maria Arce. Do grants support training of health professionals from your target countries in issue-specific international continuing education event taking place in a country outside your target countries? Well, I guess, I mean, Marta, you might want to chip into what I'm saying, but I think obviously the project that you propose needs to be implemented in one of those 5 countries that we mentioned. Exceptionally, we might consider a neighbouring country. We've also listed them in the application forms. In terms of an event taking place outside of a target country, it could be considered, but there needs to be a clear rationale for that. Why it would take in another country and not the country where the project is being implemented.
And I think to add to that, I think it would have to be a component of a wider project rather than a main activity in a project, if that's the case. And again, a good rationale for why you're requesting for support for that specific activity.
Okay, so next question by David Johnson. There can be up to 4 changes with different activities under each activity. Paul referred to a maximum of 6 activities. Does he mean 6 activities total or 6 activities per change? I understand the need to keep activities to be realistic within 12 months, but the reason for the question refers to the level of detail required in the form and the budget per change. I guess technically it would be up to between 4 and 6 activities per change, but again, I guess it would be important to consider the time frame and the quality and level of impact. If you're doing quite a few number of activities per change. You know, it might be that you're only proposing 1 or 2 changes, and so maybe that means you have time and resources to undertake a number of activities. But if you are proposing, you know, up to 4 changes, then possibly you would want to limit the activities. But I would say just consider the time frame and be realistic about the capabilities to undertake too many activities. And if anybody wants to add to that, okay. Okay, so next question from Ian Holtby is, can you clarify what you mean by unit cost? So I guess an example would be, let me just bring up the budget, other documents.
In the folder.
Okay, thank you. I'm just going to open the budget template, and so I guess an example would be if you look at the under project management communication costs, for example, phone calls. So the number of units, so the unit cost might be cost per month for telephone or internet connection, and then the number of units would be the number of months you expect to incur these particular costs, and that would refer to other budget lines as well. So if you're intending to buy or purchase some equipment, possibly some computer equipment, so it'll be the cost per a laptop or a PC, and then the number of those equipments that the volume of the equipment that you're proposing to purchase. I hope that answers your question.
We have a hand up, Nui Tian. I'm just going to unmute you so you can ask your question.
Hi, thank you. Hello, everybody. I thought we will be eligible, but can I just confirm it with you again about our eligibility?
Okay.
I've been working with the assistance from one of the Royal Colleges in the UK and a medical society in one of those 5 countries over the past 2 years. And we have plans to go back there again anyway. So can we apply for the health partnership scheme?
So
we haven't had any funding from that before.
Yeah, I mean, as long as you're an established partnership, if you've received, if you have a track record of receiving funds through, not through FET, through other organisation, that's fine.
Yes.
And
Okay.
you can explain that in your application form.
Okay, thank you. And so it will be the first time application through that. I don't know whether you can answer this or not. In such a situation, would small grants be more suitable and more practical than applying for large grants?
I think that's a question for you really to decide, and maybe consider the amount of funds that you have managed in the past in making that decision.
Sure.
And because that could be part of the rationale for why you're asking for the budget you're asking for. for that particular period. But you can, in theory, apply for both a large grant or a small grant.
Mm-hmm. For both?
It would have to be different projects if you're applying for both, but you could, if you have managed similar amounts in the past,
Mm-hmm.
you could apply for a large grant.
Okay. Okay.
If you fit
So you need it.
Yeah.
So you mean that you need, or we need, some kind of evidence and track record of having managed a large budget in the past to apply for a large grant, in a way. Sorry.
I mean, you can apply anyway, but it will be a much stronger application if you show that you have managed, because we will look at your capacity to deliver the project. So I guess it's trying to find a balance between, you know, having enough resource to deliver your project, and also whether you've got the capacity to the means, you know, the resources, the expertise to deliver it.
Sure. And the other thing is the partner in LMIC country, the host partner. Do they have to be the formal, do they have to be in the formal position in the health system in the host country?
I'm not sure what you mean.
Okay. I can explain to you that. Can they be like independent medical society, which is not part of the formal health system in the host country?
Yes, they can be.
Okay.
But again, I would encourage you to look at the requirements for the large grant as opposed to the small grant, and then make a decision based on that.
Sure. Okay, thank you.
Thanks. Right. So there's a question from Nick, who says that they have penciled in a trip for mid-November. If successful, is there any chance to sign off in time for this? It's probably going to be very, very difficult to get it signed off. Not wanting to, you know, be too pessimistic, but given that we, according to the time frame that Paris you went through, which is here.
Yes, so it's also dependent on, firstly, whether you apply for a small grant or a large grant, because if you apply for a large grant, we're going to have project meetings, inception meetings. That might take time depending on everyone's availability, as we would like the overseas partner available too. And just processes and systems from both us and yourselves in kind of getting the contract signed off in time. So I would say, I wouldn't want to mislead you and say that that would be entirely possible for your November trip. So I guess we'll just have to play that by ear, I would say. Can't confirm that.
Yes, I think I would assume that it would probably not happen, because we also need to have a contract in place, and we need to make a payment to your account if you are successful, and all of those things tend to take time. So my recommendation would try to plan it for later if you're hoping to fund it through this call.
Okay, we have a question from Jenny Wiveden. Okay, so she asked a question previously, and she's just clarifying that the question is relating to volunteers, is linked to the likely scenario that our staff costs may exceed those eligible under the project management category. Would these unfunded hours count as volunteer input? For example, would university staff not covered by the grant be seen as volunteers by FET?
Okay, I'm just going to read the question again. I'm not sure in what scenario the university's staff or their time would not be covered by the grant. I think you're referring to if the rate is, so maybe the level of their daily rate will take you over the 20%. But if they would continue to work on the project, then you would include them under volunteers. I think maybe that's what you're referring to. I don't know what other option you would have to stay within the eligible 20% threshold.
Yeah, and I think FET will be very strict on the 20% cap on project management, so it will depend also on what you see their role being, because if it's still project management type of activities, then we wouldn't be able to cover that outside of the 20%. So it's something to think about as you prepare your budget.
So we have a question from Suraj. I'm Suraj from Nepal. It looks like my country is not an immediate neighbor of Burma, one of the 5 targeted countries. However, although we do not share the border, 2 countries have similar economic and cultural backgrounds in Southeast Asia. Actually, I would like to propose a capacity building training workshop for early career researchers of Nepal. I can see that there are some HPS organizations in Nepal, but I'm not sure if they are still functional for collaboration. Thank you. So
again, if you would refer to the eligibility criteria and the I guess the focus countries, and yeah. In the past, yes, we have had projects in Nepal. We funded through THET and the HPS scheme, but unfortunately, as mentioned earlier, this is a very limited amount of funding, and it really is, for kind of projects concentrated in those target areas and for specific scale up and health themes, and so it really isn't possible to fund projects outside of those target areas, Suraj. But also, as my colleagues have mentioned, that we do have a list of funding resources which are outside of THET on our website, and you're welcome to refer to those and see if there's any opportunities for you to fund the capacity building training workshops that you're proposing.
So I think that also answers your second question, Suraj, about could the National Academy of Nepal apply? Oh, sorry. Next question: could National Academy Nepal Academy of Science and Technology partner with UK-based academy or medical institution for proposed research capacity strengthening workshop? Yeah, so as you said, the priority countries will obviously take precedence when we're selecting, but in exceptional circumstances we may consider those other countries that we've put as the neighbouring countries, but just to manage your expectations, it will be those 5 countries that we've listed will have a priority. And yes, please, so just keep an eye on our website and look at any other funding opportunities we may have at THET and also outside of THET.
Okay, great. Okay. Yeah, I'm not sure whether we've already answered this question, but okay, it looks like first of all, Wango Simo may have a question, so I'm just gonna unmute and see.
Hello.
Hi.
Hi, how are you?
Very good, thank you.
Yeah,
What's your question?
I've been following. Yeah, I've been following clearly. I'm wondering, we are a faith-based organization in Uganda. We coordinate provision of health services, and we don't have any established partnerships with the UK health institutions. And I'm seeing this round of funding is ending in 2019. How do we establish partnerships so that we can benefit in the next round of funding?
Yeah, so Bongo, I think so. Obviously, you won't be eligible for this round, but what we can do is I can send you an email with some resources that explains how you can set up a health partnership, and then there might be a few. We're launching a new website actually in a week's time, but there might be also an opportunity for you to kind of register your interest, or we've got some different kind of platforms for health partnerships to communicate with each other. So you could also sign up with something that we call the community of practice to just kind of put yourself out there and communicate with any UK institutions that would be interested in partnering with you.
Okay, please.
So I should have your email address, and I can follow up with you by email afterwards.
And also, Bongo, I would recommend looking at our website and seeing the different partnerships or projects we've funded in Uganda, and kind of seeing the health teams and what they do, and maybe you could be in touch through the community of practice with some of the partners there, and kind of get some information from them about how they went about establishing a partnership. I think that might be helpful as well.
Okay, thank you. Certainly, we'll visit the website.
Okay, thank you. And we also have a question from Linda Gibson. So Linda, I'm just going to mute you now. Okay, Linda, your microphone is on mute, so I'm not able to unmute you.
Hold on.
Ah.
There we go.
Okay, we can hear you.
Can you hear me now?
Yes.
Okay, great. I just wanted to ask a more conceptual question, really, which was around the issue of change, the kind of things that you're looking for when we talk about, the different changes, etc. I presume that they're linking to things like sustainability and impact and those kind of things. But presumably they're quite small scale change in terms of project activities, because they have to be very achievable, don't they? So they have to be the kind of change that we think ahead of time is very achievable. We have to be able to understand those before we attempt them. Do you see what I mean? So it's the whole concept of change, really, and the sort of the scale of the change and the focus of the change that we ought to be working towards within the call of the grant. That I just think it'd be useful to have some sort of guidance on that, really, particularly in terms of scope.
Okay.
Makes sense.
Yeah, I think it it does make sense, and I understand that it is challenging to think about what can be achievable within, and we understand it's a very limited time frame.
Yeah.
And I think that's also why we decided not to include a full project plan in the application form. We thought that actually it's probably more helpful to kind of have a clear sense of what changes are achievable in time, given it's a 12-month time frame. So if you're familiar with the theory of change model, that's kind of what our thinking was behind it.
Okay.
So Yeah, so that's kind of, that section is really your opportunity to think about what is achievable within the time frame, and also how it fits within the core, the sustainability, the scale up, the access. Sorry if that's not very helpful, but
because it's a judgment call, isn't it, about change and what change can be affected and what have you within the project. But I mean, supposing you're going to suggest there's going to be certain changes and they're not achieved, for example, and that might be for all kinds of reasons. I presume, that's understood.
It is, and what I want to reassure you is that once you've developed, you've defined what changes you expect to see in your application stage. This is just the beginning in a way, and if you're successful in securing a grant, there will be opportunities to look at that in more depth, to make changes along the way if you see that actually this is not achievable for XYZ reason, factors beyond your control. And I think there is also a section in the application that talks about risks, things like staff retention or anything that could go wrong. I mean, it is challenging because there's a very short time frame, and in the past we've been able to be a bit more flexible and give more time for instance, if there's been a major issue like a doctor's strike or an earthquake, we've been able to grant more time for that partnership to achieve and measure their results. But we will definitely be mindful of that throughout the project. Okay.
So I guess it's important not to be too ambitious in the changes that you put in, because otherwise you fall at the first hurdle, don't you? So,
yes. Yeah. And really see if is this change dependent on something that's really beyond your control, and does if there's a high risk, so whether, for instance, if your entire project relies on having an adequate supply of equipment or functioning equipment or supply of materials, and then actually the hospital can't provide and your entire project can't go ahead without it, then that's quite a high risk that has to be considered. So,
okay, thank you, that's helpful. Okay.
I think we've gone a bit over time. I'm just checking if there's any more questions. Right, so I think we've got no more questions. So thank you everyone for joining the webinar. And as we said, if you have any questions, you can email us at application@fet.org, and we will also make the recording available online, and we can email you the link and the slides later. So thank you very much, and bye.